Overcoming language barriers through innovative technology. Language barriers between patients and healthcare providers can result in life-threatening situations. With the ever-increasing number of migrant patients and foreign-trained staff, the possibility for communication errors between the patient and the healthcare provider, who are both speaking English as a second language, is likely. Communication is the key to providing quality care. The healthcare provider must determine if the patient has a language barrier and choose the proper assistive services to facilitate effective communication. Unfortunately, often this process does not happen, and the healthcare provider will utilize family members, friends, or non-certified hospital staff members to translate, which can lead to devastating consequences. The adverse effects related to communication and language barrier are a lack of proper informed consent, misunderstanding of physician instruction, misinterpretation of patient health information, increased psychological stress for the patient and their family, malpractice suits related to discrimination and negligence. According to the U.S. Census Bureau 2013 American Community Survey, the number of people speaking a language other than English has increased from 2.2 million in 2010 to 61.8 million in 2013, with Spanish being the highest at 38.4 million. The patient who is evaluated and determined to have a language barrier and the healthcare provider who is providing care to that patient are the target population. The competition in current practice. Current practice in many healthcare organizations is the use of a double handset telephone. The healthcare provider and the patient each take a handset and speak to the interpreter, who translates back and forth between the two individuals. This process is difficult as the interpreter does not see the person they are interpreting for and cannot take cues from facial expressions, which can diminish the efficacy of the interpretation. The proposed product is the Stratus Remote Video Interpreting System. This includes a tablet attached to a mobile cart that can be adjusted so that the patient and the healthcare provider can easily see the screen. The unit is easy to operate simply by turning it on, selecting the desired language, and then the certified interpreter comes on the screen and can communicate with both the patient and the healthcare provider at the same time. The cost of this technology for the initial video remote interpreting is $2,500 for the tablet, software, and specialized stand. Interpreter time is $30 per hour, with an average time spent per session is 15 minutes. There is also an annual fee of $250. The cost to train staff is minimal, requiring no more than 10 to 15 minutes to fully understand how to operate this technology. The potential cost savings to the healthcare organization is significant. VRI sessions are typically shorter than phone interpreting. Readmission rates are decreased when VRI is used and admission and discharge. There is a decrease in the number of diagnostic tests required for treatment and a decrease in the risk of liability and malpractice. The financial benefits, as I just reviewed, the readmission rates, better HCAP scores, decrease in the amount of the diagnostic testing because patients are able to better express what's going wrong with them, and then the decrease in liability and malpractice, as I said before. The implementation is easy as basically 1, 2, 3, and if you see the login steps on the screen, you simply turn the tablet on, select the desired language, and then give a brief description of the situation and introduce the patient to the interpreter. Policy and procedure. There really are no resulting changes in policy with the implementation of the video interpreter. It is still the expectation that each patient will be evaluated for a language barrier, and should the patient be deemed as limited English proficient, the video interpreter will be utilized. It is also expected per the policy that any language barrier will be documented at each visit, and also each video interpreter every time it is utilized. Efficacy. The efficacy of the remote interpreter can be determined and tracked by more than one metric. The electronic health record should be audited to determine if there is documentation to support limit English proficiency, as well as documentation stating that the remote video interpreter was utilized. Efficacy can also be observed through decreased readmission rates, improved patient satisfaction scores, and improvement with HCAHPS scores. The remote video interpreter is highly marketable and would not be difficult to sell. It is far superior to the double handset phone interpreter system. Patients feel more engaged and comfortable with an interpreter they can see. This technology will appeal to healthcare organizations with a proven decrease in readmission rates, improved patient satisfaction, and decrease in liability and malpractice suits. I do not think I would have any trouble selling this technology. It's easy to use, affordable, and closes the disparity caused by language barriers. Remote video interpreting closes the disparity of language barriers. Patients are more engaged in their own care with the use of this technology. Video interpreters are able to pick up on nonverbal cues that may be culturally specific. The initial investment will more than pay for itself with a decrease in diagnostic tests and reduction in readmission rates. Thank you.